The Prime Minister has tonight been moved out of intensive care and is now on a ward where Downing Street says he will receive close monitoring during the early phase of his recovery. He's been in hospital since Sunday. This afternoon, the Foreign Secretary, Dominic Raab, who's deputising for the Prime Minister, said the lockdown across the UK will remain in place for now. He said deaths are still rising and we haven't yet reached the peak of the virus. The government's chief scientific advisor, Sir Patrick Vallance, warned that the number of deaths will continue to rise for a few weeks. The latest figures today show that another 881 people have died in hospitals in the UK, but that number does not include deaths in the community or in care homes. It brings the total number of deaths in the UK so far to almost 8,000. We'll have the latest on the Prime Minister's condition in a moment, but first here's our health editor, Hugh Pym.
It was just so dreadful that no one was able to visit him for 3 weeks, and furthermore, no one was able to be with him during his final hours and minutes.
Emily remembers her grandfather, Tony, who died yesterday. He'd gone into hospital with another health issue and then contracted COVID-19.
I can't imagine what...
She told me visitors weren't allowed because of the virus risk, but she's reassured to know 2 nurses were with him in his final hours.
For me and my relatives, it is really comforting just to picture those 2 amazing people at his bedside, comforting him and saying all the right things at the right time. And we'll forever be in their debt, and are just so grateful for everything they did.
I raised the issue at the Downing Street media briefing today.
We've heard some harrowing stories of people dying alone because family can't be with them for understandable reasons to do with the virus risk. What do you say to the British public about how things will develop from here?
We don't know conclusively that we're beyond the point at which we could start considering whether the measures will be relaxed. So we must keep it up. And I think the key thing is for people to understand how much of what they've already done has helped contribute to avoiding an even worse situation in terms of the spread of the virus and the number of deaths, and how important it is that we don't slow up or take our pressure off at this critical moment before we've come through the peak.
There was a clearer prediction than before how long deaths would go on rising.
In general, I'd expect the deaths to continue to keep going up for about 2 weeks after the intensive care picture improves. And so we're not there yet in terms of knowing exactly when that will be.
The latest analysis of data in England and Wales suggests that death rates go up with age in both men and women, but men are ahead of women in all age groups. Alex died in hospital with the coronavirus 10 days ago. None of his family could be with him. But staff did set up a video call, and his son says that made all the difference.
It felt like we were together. It was really rich. It was really real. He was weak, but we also connected as a family. So often there'll be 3 or 4 of us on the telephone, a group video call, and we could speak with each other, comfort each other, make plans. We felt together, which is, I've not really experienced that before.
This is what patients will be aware of around them. Staff like these at Papworth Hospital in masks, visors and gowns. It's confusing and communication is difficult. That's tough for doctors and nurses, as well as those who they care for. Dr. Rachel Clark, who specialises in end-of-life care, says it can be an emotional drain.
Sometimes at the end of the day, you take off your gown and mask and you just cry your eyes out in the car on the way home because you have seen things you don't want to see, but at the same time you've tried your utmost to be there at a time when perhaps a loved one, a son or daughter or spouse can't be there, and you're literally all a patient has, and with every fibre of your being, all you want to do is support that patient.
The upward trend in deaths appears to be slowing, but whatever the statistics say, there are life and death issues for thousands of families to confront every day in every part of the country. Hugh Pym, BBC News.
Well, the Prime Minister is spending his 5th night in hospital in London. Our chief political correspondent, Vicki, is outside St Thomas's this evening. What more do we know about the Prime Minister's condition then?
Yeah, well, as he prepares for that fifth night, some positive news for the Prime Minister and his friends and colleagues. He's been moved from the intensive care unit back to the ward at, say, Downing Street, where he'll receive what they call close monitoring during the early phase of his recovery. Early phase, I think, a suggestion there that this will not be a rapid process. Now, what's that likely to mean? Well, it could mean that he still has to have his blood pressure checked, for example, maybe his oxygen levels, given he has needed help with his breathing while he's been here. Now, there's been a reaction to this news from around the world. President Trump, one of the first to tweet, saying, "Great news, get well, Boris." Sir Keir Starmer, the Labour leader, saying, "I really hope this is the start of a speedy recovery." And then there was this tweet from Carrie Simons, the Prime Minister's fiancée. I think we could call that a very enthusiastic round of applause there for key workers, including NHS staff and carers, who have, of course, been looking after her fiancé here over these last few days. Now, Cabinet Ministers too saying they have been extremely relieved by the news tonight, although one I spoke to said it's very important that the Prime Minister takes his time getting back to work, that a full recovery is much more important than getting back behind the desk. And of course, no one at this stage knows how long that might take.
Vicki, thank you. Police have told people to stay at home over the Easter weekend and warned that they will crack down on anyone found breaking the rules. Warmer weather is forecast over the coming days, with temperatures set to reach 25 degrees in certain parts of the UK. Danny Savage reports from Cumbria.
The signs are clear, but still not everyone is getting the message. PC Andy Docker was guarding one of the main roads into the Lake District today, and there's a need to do so.
I'm not running every vehicle plate through the box. We're not sort of being Big Brother, but what I'm doing is using the policeman's sort of nose, if you like. And if a car's coming into the county and past me, there's more than one person in it, and they're from out of county, they're going to get stopped.
A car with a canoe on the roof then drifts past. Andy runs a registration check.
Right, I'm going after that.
And then heads off. He later tweets a picture of the stop. Two men from more than 80 miles away are ordered to do a U-turn and go home. In nearby Bowness, police were checking with bed and breakfasts that nobody is trying to book in.
Closed down. We've closed down. We've booked and closed till the end of May. Well, actually, going to go to June, really.
Okay.
Negative from Bowness.
Airbnb today announced they are stopping all new UK bookings for non-key workers for at least the next 10 days. But search online for somewhere to stay in the lakes and you can still find availability.
It's very frustrating. All accommodation providers must go and block out their availability, both on their own site and on third-party online travel agents as well. It's very important that at this time we don't give the impression that we're open for visitors.
This is why people want to come here. And on a perfect spring day, a bumper bank holiday weekend would be expected. But not in coronavirus Britain.
I can't tell you how cripplingly difficult it is for me to say to people to stay away from the national park when I've spent 12 years in this job encouraging people to come here. But right now it's important that we concentrate on fighting this virus and people don't visit the national park but do stay at home.
Away from the tourist sites, Cumbria's sports centres are being turned into makeshift hospitals. This county is one of the worst affected areas outside of London. Checks are taking place nationwide, but the Home Secretary says these comments from one Chief Constable go too far.
We will not at this stage be setting up roadblocks. We will not at this stage be starting to marshal supermarkets and checking the items in baskets and trolleys to see whether it's a legitimate, necessary item. But again, be under no illusion, if people do not heed the warnings and the pleas that I'm making today, we will start to do that.
Police are also warning people not to take the law into their own hands. That's after a district nurse staying at a holiday home a few miles from here woke up this morning to find all her car tyres had been slashed. Now, she's not a tourist. She was just a key worker isolating herself from her family whilst working in the community. There's concern again that a minority will disregard the government restrictions which have left so many places deserted. Danny Savage, BBC News, Cumbria.